Hello everyone. I am Dr. Berkkkaratas. We continue with vacuum therapy and erectile dysfunction. Vacuum therapy is not a treatment that we use much on its own today. We can usually use it for 3 reasons. The first is how to get an erection before intercourse. This is not meant to be a cure. Before intercourse, people can have intercourse for 15 to 20 minutes for a while after applying vacuum. We mostly use it in addition to first and second line treatments, namely drug therapy, shockwave therapy or needle therapy. There is indeed a lot of data here in clinical studies that it improves erection, especially when used in combination with drugs. It is used for penis enlargement. As you know, they are sold a lot both on social media and on the internet. Scientifically, if you apply the vacuum therapy vacuum device for 20 minutes a day for 6 months, it provides a growth of approximately 5 to 6 millimeters in the penis. Of course, this does not make any sense for us scientifically and statistically. That's why we do not use vacuum therapy alone for penis enlargement. I don't recommend it either. Vacuum devices are one of the most common questions I get about which vacuum device to buy. In fact, technically, whichever you get, since this creates a physical effect, they all have the same effect in the end. My more suggestion is that if you are just going to get an erection in the penis and have intercourse, you don't need to pay a lot of money. You can get this simple pressure gauge, which is inexpensive, which does not exist. But when we start drug therapy in addition to other treatment, we usually recommend and use the device, which is automatic and has a pressure gauge. The mechanism of action is quite simple. It has a mechanism of action. It works in 2 ways. First of all, when we take the penis into this device, we create a negative pressure here manually or automatically. This negative pressure fills the penis with blood. The second effect is that thanks to the narrowing ring we have placed on the root of the penis, the blood coming into the penis is pressuring the vein here. This ring is pressing here, preventing the return of the blood. In other words, we draw the blood in, but we do not let it go back, and as a result, there is an erection. Of course, there is a very important point here, which is that this device can be used for more than 20 minutes, that is, in some clinical studies, it can be set in 30 minutes, but we need to use it for more than 20 minutes. Because there is blood pooling inside, we allow blood to enter, but not to exit. If we hold it longer, there will be a serious malnutrition in this area for 20 minutes and therefore we may have some problems. We will continue with penile prosthesis treatment in erectile dysfunction. Thank you.